Good morning. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing 8 new cases of COVID-19, bringing our total cases to 72. The total number of deaths related to COVID-19 remains at 1. At this time, there is 1 individual receiving care in ICU and another admitted to hospital. All other cases are recovering at home currently. We have reports that 2 individuals are listed as recovered. Public health investigations are continuing, and to confirm details and information will be updated on our website once it's available. As of Friday, 7,147 tests have been completed for COVID-19 at the Chatham Provincial Lab. On Friday, there were 919 tests performed. Additional data will be provided later today on our website once it's available. Manitoba has its first COVID-19 clinical trial underway. This study will test if a rheumatologic drug known as hydroxychloroquine can prevent people from contracting COVID-19. I want to note that Manitobans should not use any drug without medical advice. This trial is being led by a team at the Rady Faculty of Health Sciences at the University of Manitoba. This team is recruiting volunteers to participate in the study. The trial will determine if the drug can be safely used as a treatment for COVID-19. People who are eligible include those that have been tested positive for COVID-19, those who live with individuals who have tested positive, as well as healthcare workers who were exposed to patients with confirmed positive infection. The university is hoping to get as many Manitobans as possible enrolled in the clinical trial as fast as possible. If this study is proven successful, it could lead way to treatment options for Manitobans. Manitobans who meet these criteria and wish to participate should visit covid-19research.ca. I want to remind Manitobans that public health does not recommend the use of masks in public spaces for people who are not symptomatic. This virus is spread through droplets created by coughing or sneezing, and it is contagious through close contact to infected individuals. Coughing into the sleeve, good hand hygiene are one of our best ways to protect ourselves from the virus. If an individual is sick or experiencing symptoms, wearing a mask can prevent the spread of this infection. Of course, those individuals who are ill should be at home and can call Health Links for further advice. An updated public health order under the Public Health Act comes into effect 12:01 a.m. on Monday, March 30th. This will limit public gatherings to no more than 10 people at any indoor or outdoor place or premises. I want to reiterate that we are not helpless against this virus, that now is the time for action. The social distancing strategies that we've had in place for over 2 weeks now, that we continue to escalate, are our best ways to interrupt the transmission of this virus. Because this virus is spread through those droplets and through close contact with other individuals, practicing social distancing consistently will interrupt that transmission of the virus. We all have that role to limit the impact of this virus on Manitobans. The best way to limit that impact is to stay home. Stay home if you can. If you must go out, then practice strictly those social distancing strategies. Stay 2 meters from other people. Frequently wash your hand. Certainly, if you're home, if you're sick, stay home. This is also quite important to those at increased risk of the severe effects of COVID-19, those over age 65, those with underlying medical conditions, those with immune compromise should be staying home as much as you can to limit the chances of being exposed to this virus. I want to remind Manitobans that one of our tools to battle this virus is credible information. Please visit our website at manitoba.ca/COVID-19 for up-to-date information. I again want to thank all Manitobans that have stepped up in our battle against this virus. Many Manitobans are taking extra measures to reduce the spread of this virus. I want to thank our healthcare workers at the front lines and want to ask all Manitobans, do your part to protect our healthcare workers on the front line. So thank you very much, and I'll pass it over to Lynette.
Thank you. So I'm Lynette Siragusa from Shared Health, and I'll just give a quick update on the operational things that are happening within the system. So just to let you know, HealthLinks has made lots of changes. They now have hundreds of lines, increased staff, and have a cloud-based technology. So they're in the process of testing and validating the numbers. So we won't have those reports until later next week, but at that time we will make sure that we share the volumes and the wait times. Our online assessment tool has garnered almost 10,000 views as of yesterday, yesterday, and then since we launched on March 17th, there's been about 330,000 views. So it's great to see everybody using that tool. A new community testing site will officially open tomorrow in Pine Falls at École Power View. The hours will be 9 to 4, Monday to Friday. And as a reminder, those community testing sites are not walk-in clinics. A referral is needed to go there. Dynacare, as mentioned yesterday, is now working with us to report those negative results. So they will be back at it on Monday. And so expect a phone call soon if you have been tested with negative results. A reminder that if you are positive, the public health team will be calling you expeditiously. And just a comment, yesterday, Dr. Roussin sent me an email from Altona about some great community spirit that's happening in the face of all this adversity, and it really speaks to what a great province we have. So we've heard about wonderful gestures of kindness and great acts in every community over the past couple of weeks. So I just want to share with you some information that we received about Altona. The residents in that community are placing pictures in their windows so that passersby can see, and there's kids who are writing with sidewalk chalk words of encouragement so that it lifts the spirits of the community. There's also a local salon that's now shopping for customers and delivering goods to their home, and a local church is collecting random cards of encouragement to deliver to people in personal care homes. So just a really nice letter from Benita Beige, and we want to thank her for reaching out and finding the silver lining in this difficult time. So we appreciate that very much, and we will open it up to questions.
First up will be Eric from Global News. So, Dr. Roussin and Ms. Siragusa, you've said in the past that part of the reason, or rather that health officials are monitoring people coming into hospitals under respiratory distress, and that would be an indicator of possible community transmission. Can you tell me anything more about that? Has there been an increase in people presenting to hospital respiratory distress in the past few days, or is it still consistent?
I can speak to that because I'm looking at the numbers, the data right now, and we do know that influenza A specifically is still circulating out in the community. So we're watching those test results as well as COVID-19. The volumes coming in through emergency with influenza, like respiratory issues, are definitely, they're still there, but they do look like they're trending lower than they would have maybe a few weeks ago. So we continue to watch and monitor.
And what measures, if any, that have not already been announced in general protocol, do public health officials suggest to avoid that possible increase or possible community transmission?
I'm sorry, I didn't catch that question.
Yeah. So, I mean, there are the various protocols that we've been talking about to prevent community transmission. Can you just kind of go over those again, and what has Manitoba done and what will continue to do to prevent possible community transmission?
Right, yeah, so great question. So we know that this virus is spread through droplets in the air, could be on surfaces that those droplets fall on, but it's from symptomatic individuals mostly, and from close contact with them. So all of our social distancing strategies put that into play, that if we limit our contact, our close contact with others, then we're not going to be able to spread that virus to others, and we're not going to be able to be exposed to that virus to others. So we've continually decreased the group sizes. So we've gone from 50 down to 10 starting tomorrow to limit, limit the possibility of close, prolonged contact. We've given the message to stay home. If you're able to stay home, then you're not going to be exposed to this virus, and nor if you did have the virus, you're not going to be able to expose others to that. Self-isolation guidelines. We know that still the majority of cases in Manitoba are related to travel. If you return from Manitoba, you must self-isolate for 14 days and monitor your symptoms. You call HealthLink should you develop any symptoms, but many of these cases that we are detecting have been doing just that. They've been self-isolating, they attend care after calling health links, and then they're back in isolation. So they've done their part. We've limited the risk of community transmission from those individuals, but we need everyone returning from travel, whether it's international or other places in Canada. You must self-isolate for 14 days. It's one of our best tools right now to limit the importation of this virus, as well as limiting the risk of community spread. And then linked to that is now is not the time to travel. Right? We should all be canceling our travel plans. We're in a pandemic right now. We're seeing this virus spread at a community level around us, at other jurisdictions in Canada, certainly to the south of us. So now is not the time to travel. Now is the time to cancel those plans. Now is the time to stay home. Wash your hands frequently, and follow our credible information on our website.
Next up is Maggie from the Free Press.
Hi, Dr. Roussin and Mr. Roussin. Maggie here from the Free Press. I just want to talk a little bit. I know that in other jurisdictions there have been conversations about best case scenarios, worst case scenarios, and a recent government document from Saskatchewan that was leaked to the media shows that the worst case scenario there, deaths could be as high as 15,000, but estimates are between 9,000 and 15,000. Why is there not been any talk so far of worst case scenarios? Can you comment on that number, please?
Right, so we have been, right from the beginning of this, doing different forecasting, but the earlier you forecast, the wider that range of possibilities, certainly before you're seeing that community-based transmission. So we've had a number of different forecasting models in place so we could start preparing the system, but as we get more and more cases, as we have more evidence from other jurisdictions, we're going to be able to tighten up those models a bit more, knowing that no matter what model you come up with, there is a large range. We continually put different interventions in place, and so there is a lot of variables with these numbers. So we are working on that. We're likely to have some numbers that we'll be able to share in the upcoming weeks, but certainly we've been preparing based on a number of different tools, but a lot of variables in place there.
Okay, on that note then, have you been in touch with the Saskatchewan health authorities, and considering our population size, is there any chance that we may see similar numbers to Saskatchewan?
We're in touch constantly with all the provincial and territorial governments. Our special advisory committee, we meet many times weekly discussing all these issues. So we're constantly in touch, and we're looking at our numbers compared to jurisdictions outside of Canada. We look at jurisdictions within Canada. So we've been working on all of these aspects.
from the Winnipeg Sun, Josh.
Hi, this is Josh Aldridge from the Winnipeg Sun. I was wondering if you could tell us more about this clinical trial for treatment. What kind of a treatment are we looking at, and I guess what's the potential of this treatment if it is something that will work?
Right, so it's an important work because we do not have a proven pharmacologic intervention for COVID-19 at this point, and so the only way to find those things to show that they're effective is through trials such as this. So this medication is hydroxychloroquine. It's been used for malaria, also for rheumatologic conditions, and so right now it's not a proven therapy. But we don't have a proven therapy, so these trials are essential to try to give us those results on whether we may have an effective pharmaceutical intervention. So it's cautiously optimistic, but it's not proven to be effective. But we need trials like this in order to do so.
How many people do you need in a trial like that to prove whether it is effective or not, and what are some of the risks with this trial for people who may be interested in joining it?
So for trials such as these, typically you'll need large numbers. There's various calculations on that, but this is part of a multi-center trial. So Manitobans will be linking into other areas that are running the trial, so that immediately gives us the benefit of those large numbers when we start looking at the results. As far as the risks of the medication in a trial, I would direct anyone interested in it to the information that was provided, and the research team are best to list through the requirements and the risks.
CTV Winnipeg, Jeremy.
Hello, Jeremy from CTV Winnipeg. I'm wondering, the Chief Public Health Officer of Canada has talked about an increase in cases in younger people. Is that something we're seeing here in the province as well? We're seeing more people kind of under the age of 40 contracting the virus?
We do. We do see all age groups now have contracted this virus. We know that the highest risk individuals are those with underlying medical conditions, as well as those over age 65. But we have seen severe outcomes in younger individuals as well. So this condition is important for everyone. It doesn't matter what your age is, because even if you do not have a severe outcome, by not practicing physical distancing, you could be passing this on to someone who will sustain a severe outcome. So we do see positive tests through pretty much all age groups at this point, and so it's just important for all Manitobans to be aware of their role to play in this. Wash your hands frequently, stay home. If you must go out, practice physical distancing at all times.
And I'm wondering, are you able to talk about, I guess, maybe some of the details of maybe some of these new cases? Or I'm wondering, can you confirm whether or not there has been a case in any long-term care home in Manitoba yet?
I have not received a report of that.
Okay.
From CBC Radio Canada, Catherine.
Hi, Catherine Logan from CBC Radio Canada. I was just wondering, could you tell us what the current capacity of CADM Lab is? How many tests can be processed daily?
Yeah, well, this figure is shifting daily due to a lot of their innovative methods. And so right now I would just say that our last report that we received from Friday is they were able to test 919 samples. And so that is what I would report as their current capacity. We're still waiting on their numbers from yesterday, and so we'll be able to publish that later today, hopefully.
Excellent. And could you please remind us just of the criteria or who's eligible to be tested?
So for right now, those that are at highest risk are returning travelers within the last 14 days who have symptoms of respiratory illness. And those symptoms are really a key for any eligible group. We're only wanting to test symptomatic individuals, fever, cough, respiratory illness, shortness of breath, those type of things. In addition to the returning travelers, testing is available to all symptomatic healthcare workers, as well as those that are symptomatic in congregate settings, such as corrections or homeless shelters, and this would also apply to First Nations communities.
Excellent. Thank you very much.
From CBC Manitoba, Bryce.
Hi, folks. Bryce Hoy here with CBC Manitoba. Dr. Roussin, I guess this question is for you. How many days go by between the time that you know of new cases and the time that you tell the public about these new cases at these conferences?
So a contact investigation. So typically it just depends on the turnaround. So once public health is aware of a positive result, they will contact the case immediately, and right at that time, then a contact investigation starts. And so once they become aware of contacts, those are again contacted immediately. And so it's the actual time frame is different. It depends on how many contacts an individual may have. It depends on how much information that case can remember right off the top. So there are a lot of variables in there, but the investigation starts immediately, and contacts are contacted as soon as possible.
So you don't really have like a working average in terms of when you can expect a sample that tests positive in the lab and when you actually learn of it and then inform the public? There's a kind of an average range yet?
No, that would be a real difficult average to come to. So certain certain cases may have 2 or 3 contacts. Others could have up to 20. And so it's a real tough thing to average report back. We're focused on getting that work done, not necessarily recording all the times involved.
Okay. I'm not sure if that qualifies as my follow-up or not. But I guess I just wanted to also ask, yesterday and today we've got new cases announced, but we haven't heard the ages or the sex or gender of these folks, where they're from. Can we expect to get that information for the cases from yesterday and today?
That's going to be posted on our website as soon as we get that information. So again, in our commitment to report cases as soon as we know to Manitobans, then often we don't have that information right at hand. And so we'll update our website as soon as that's available.
Okay.
From City News, Jonas.
Dr. Roussin, with the new 10-person limits coming in tomorrow, can you just expand for folks watching this as to what exactly this applies to? If they go into work tomorrow and there's 20 people there, will they then be able to head home, or recommend them to head home? I guess can you just explain that a little further to folks?
Right. So these are public gatherings, indoors or outdoors. So that 10 limit does not apply to workplaces. But again, as I've been saying, is that we as Manitobans are in this together. We're seeing increasing cases. We've seen severe outcomes. So we all need to be doing what we can to interrupt the transmission of this virus. So we have orders in place. We have some tools, but there is no need to look and see if an order applies to you. You should act right now to limit the spread of this virus. And so this order doesn't apply right now to workplaces, but that really shouldn't matter. We're in a pandemic. We need all Manitobans to step up now to reduce the transmission of this virus.
And just one for Lynette, if I can, guys. The ER numbers you're tracking, it sounded like BC came out either yesterday or the day before and said it seems to them that maybe they're flattening the curve already. is it too soon to say here in Manitoba, or is this? I guess this is encouraging a sign, but is it too soon to draw any conclusions from it?
Are you speaking specifically about the visits to emergency?
Yeah, you said that earlier, I believe, that they're kind of lower than what you had anticipated, or they're manageable. I don't want to put words in your mouth, but I think that was the sense.
Yeah, so what we're seeing is probably people are staying home more, and people are social distancing, and there may be the fact that people aren't wanting to come to the hospital and maybe going to access centers instead. So we're seeing the trend not just in emergency, but also on the inpatient medical units as well as critical care. The numbers are lower than what we usually live with. So it's hard to know what all is happening. We consider it it's good. I don't know that we've flattened the curve yet. It's quite early on, but certainly that would be our goal and intention. And as we look at it, the rates and the growth in other jurisdictions, I think Manitoba is doing pretty good, but we still have to be vigilant and follow our social distancing, staying home when we're sick, and washing our hands frequently.
All right, we're going to have time for a second round. Back to Eric at Global.
So, when I kind of just stemming off of what this might sound like an odd question, but how would we know whether we have flattened the curve? And I think that answer seems obvious, but just some clarity on what that actually would look like.
Mm-hmm. So I guess, and Dr. Roussin can jump in as well, but when we look at other jurisdictions like China and Italy and Spain, there's a sudden spike. So the goal is that we can manage the volumes, and we know there's going to be spread, and we know the volumes are going to increase, but increase at a manageable rate would be our goal. So we know that there's been 2 admissions to critical care. We've had 1 death, and we have 1 patient in hospital right now. So that to us is it's pretty flat with that, but we'll have to keep watching. Like, it's really too early to say. We're going to have to watch the trends and watch the volume over time. Did you have anything to add?
Yeah, I think that's exactly right. It's too early for us to talk about flattening a curve. We're still in a bit of a containment right now and case finding. If we look at a jurisdiction like BC, where they have over 800 cases, then they can do some modeling to show that their interventions have been having an effect. So for us, we'll continue to be aggressive in our social distancing strategies, and then absolutely that's our goal, is to flatten that curve.
Thank you.
Over to Maggie at the Free Press.
Hi again, it's Maggie here at the Free Press. Just going back to the first death that we had heard about on Friday, I was wondering if you guys were able to comment on how that individual contracted COVID-19. Was that a travel-related case?
So we're not going to release details about an individual case. It was a COVID-19 related death, and like we've mentioned, a tragic day for us here in Manitoba. But we're not going to discuss specifics about an individual.
Okay, and the other one is just from what you guys have been seeing, are Manitobans following social distancing well enough and taking this seriously?
I think so. I think that Manitobans, the majority of Manitobans, are taking this seriously. I think more and more are taking the time to learn about the importance of it every day. And we're strengthening our messaging because we want to just ensure that message gets out there. And so I'd encourage all Manitobans to go to our website. But really, it's, we talk about this modeling data, and we look at worst case and different numbers. In a way, that implies that we're helpless, and we're not. right? We don't have a number right now that we're going to hit because we can change that. If all Manitobans work together, if we all do our part to practice social distancing, then we don't need to worry about worst case scenarios. And so that's what we're really trying to push forward right now with our messaging, is that we're not helpless on some modeling number. We can make changes starting right now today to interrupt the transmission of this virus. And thank all Manitobans that are doing that right now, and encourage all Manitobans, if you haven't yet, start today. Start today, and we can make a big change.
From the Winnipeg Sun, Josh.
Hi, this is Josh from the Sun again. Just looking at some stories out there about provinces, different provinces looking at non-traditional medical sites, turning recreation centers into makeshift hospitals or containment areas. Are there plans for that here? I know we have a relatively low number of cases compared to BC, compared to Ontario, Quebec, Alberta. But what happens if we see our numbers jump? Are we prepared to open up some of these recreation centers that have been closed down as makeshift hospitals?
Yeah, as part of our planning processes, we are looking at different settings where we could expand capacity if we needed to. And that's remembering that the majority of COVID-19 patients are okay in the community. Most of them won't need to go to the hospital, but they do need a safe place to isolate and get through that 14-day period. So for sure, not everybody has that opportunity to self-isolate in a family or in a dwelling. So we're looking at all options, and we will be reporting something in the near future in terms of what those alternatives are.
Do you have an idea of what kind of buildings that you'd be able to talk about that we'd potentially be looking at here in Manitoba?
Yeah, we have a few things in the works right now, and once we have a better idea and confirmation, I'll get back to you.
Thank you.
Thanks.
From CTV Winnipeg, Jeremy.
I remember we were informed about an apartment building in Winnipeg that for the last couple of weeks has been without water for several days at a time. I'm wondering, can you just talk about the importance of having hot water at a time like this to be able to wash your hands, shower, how vitally important that is to try and help flatten this curve?
Yeah, well, certainly the ability to wash your hands frequently is very important, and so encourage all Manitobans to wash your hands as frequently as you can. If you don't have that water or soap available, then alcohol-based hand sanitizers are effective as well. So frequent hand washing is a very important aspect to flattening this curve.
And hoping for a little bit of clarification on the numbers. We're now at 72 cases in the province. You talked today about two patients that have recovered. Are those two recovered cases included in that total? How does that break down?
That's correct. Great question. So this is the issue with our total numbers is that they can only go up. So we will expect them to go up. And so that's not the only thing we need to focus on as Manitobans looking at this. We're going to look at those recovered numbers. An important number to look at that we're going to start trying to find a way to report is the rate of increase, because that's what's going to tell us what's flattening our curve or not. And so those total numbers, they can only go up. And so that's not the only indication of how we're doing against this virus. So it's a good question, and our recovered numbers are going to go up as well, but they're not going to take away from the total cases.
Sorry, if I can just clarify. So that means any recovered cases will not be retracted from the total number, correct?
That's correct.
Thank you.
CBC Radio Canada, Catherine. Catherine. From CBC Manitoba, Bryce.
Hi, folks. Bryce Hoy again from CBC Manitoba. This can go to either of you, I suppose. What does the province plan to do in terms of monitoring the number of people in public spaces like parks come Monday when the gatherings are limited to 10 or less? We've already seen federal parks close entrances. Hearing reports that people were flooding into Birch Hill yesterday, for instance.
Yep. So there's a number of methods in place to monitor those type of things. So these groups of 10, in large open spaces, it's the groups of 10 within that close contact is what we're concerned about, right? So we're going to have things in place to respond to such things. But again, we're just getting that message out to Manitobans to ensure that they know the importance of staying home. Getting out, getting some exercise in certainly is important. We need to take care of ourselves during this time. We need to be not socially isolated. We need to be reaching out to others and keeping in touch. But if you're getting out to a park and you notice that there's crowds starting, you need to turn back. This is not the time to ignore our social distancing strategies. We have to maintain that 2 meters between other folks, and we have to keep ourselves healthy. But right now is that time, strict adherence to social distancing strategies.
Okay, thanks. This one might be for Lynette and this follow-up. Is Health Science Center isolating people who are traveling in from northern Manitoba, like as if they were, returning from international travel?
No. The answer is no.
Okay.
They rely on us for their health care, and especially if it's based in facilities and acute care. So we continue to serve them.
Thanks.
And finally, from City News, Jonas.
I'll pass on this round, guys. Thank you much.
All right, thank you very much. That concludes today's media briefing.
Thank you.
Thank you.